So a root canal is a procedure in which we treat the nerve of the tooth, whether that nerve has been infected or it is damaged due to trauma that the patient has experienced, but we actually treat the entire nerve of the tooth, including the root structures. So the first step of a root canal is getting the patient adequately numb, right? So done correctly, a patient should not feel a root canal. It should be just like getting a filling or a crown. Then we actually access the nerve chamber of the tooth, just like as if we were prepping out a filling. So after we've accessed the nerve chamber, we clean the tooth up from the root up, okay? We're going down the root with different instruments, files, clean it with different disinfectants. Any nerve tissue or bacteria that would remain in the tooth comes out during that process. After that, we fill the tooth up from root to top. So just like if you were getting a filling that's only on the part of your tooth that you see in your mouth, the root is actually going to be filled. A root canal would be required when a patient has gotten decay that has reached the nerve of the tooth. Sometimes that patient is feeling pain, sometimes they aren't yet, but we can see it on a radiograph that it's already there. Sometimes the patient requires a root canal because they have experienced some type of trauma. Maybe it was a car accident. We get a lot of athletes that get hit in the mouth. Another situation in which a patient would need a root canal is if they're experiencing swelling or have an abscess that's draining in their mouth. The after effects of a root canal are truly patient dependent. The patients that are coming in and they were in an immense amount of pain before the procedure almost always feel better after, right? So it's not going to be the same type of excruciating pain you were having before. Typically, I would say 99% of patients may feel some soreness after, but I've had several that say they feel totally normal the next day.